Turning now to the fight against COVID-19. With the rapid spread of the Omicron variant, these are not easy days for parents, kids, or anyone trying to navigate the ever-changing pandemic.
No kidding. Fox 12 Spencer Thomas spoke with a local medical professional to get some answers to some of the questions you might be asking yourself. Spencer?
Yeah, that's right. I think we can all agree that our day-to-day has drastically changed in comparison to 2 years ago. And for some, it's tough when walking out the door not to think of those what-if scenarios in your head that may or may not become reality.
Even though we are seeing milder disease with Omicron, we're seeing more of it. And so even if you had, say, a variant that was 10 times less dangerous for people, but it was 10 times more contagious, you ultimately end up with the same situation as with Delta or Alpha.
Because of this fast spread, many of you may find yourself typing into your search engine certain scenarios or questions that you're curious or nervous about, and they all end in, "What do I do?" We spoke with Dr. Molstrom with Legacy Go Health Urgent Care, who gave us his best opinion on some of your questions. If I was a parent and my child was exposed to another child who tested positive for Omicron, should I keep him or her home from school? As a parent, do I stay home from work? Does the situation change if I'm vaccinated, boosted, or unvaccinated?
I would say a family or mom and dad should follow the advice of the school nurse, as they ultimately have the jurisdictional call about whether or not a child should go back to school or not. In general, though, if the student has been vaccinated and fully vaccinated, then the student doesn't need to stay at home if they're feeling well. So that's why I say a vaccination is a little bit like a get out of jail free card for the most part. If you've had a simple exposure to somebody, say in the class with COVID, and if you've been vaccinated and you're not sick, you do not need to stay at home and quarantine. You should still be wearing masks and taking extra precautions, though.
Dr. Molstrom mentioned if your child is not vaccinated in this situation, they should quarantine for a period of time, then monitor for symptoms.
If I tested positive as a parent, do I keep my kids home from school to negate spreading that variant?
My guess is that they were going to have the children stay at home and quarantine if you as a parent or caregiver are positive and not able to isolate.
We went on to ask what Dr. Molstrom referred to as the most common question of all. If you or your kids are exposed to the variant and quarantine for the recommended number of days, but can't find a test to make sure you're negative due to the shortage and limited appointments, what do you do?
Probably the most burning question everybody has. If there's any illness symptoms in this case and you can't get tested, so that might be simply, I have a bad headache today, which can be tough for some patients who kind of typically get headaches, right? It's very common. Or just feeling off, achy, a sore throat, even a mild one. I would recommend just assume at this point that it could be Omicron and just stay home.
Dr. Molstrom also said if you are feeling symptoms of Omicron, mask up and go to one of your primary care doctors or an urgent care like this one right behind me, or go to one of your local testing sites or try your hardest to find those at-home tests. And he wanted to make sure to tell people also that unless you are feeling severe symptoms, do not go to the emergency room. For now, we're live here in Cedar Hills. Spencer Thomas, Fox 12 Oregon.